Coming up, a look behind the highly publicised human trial for a coronavirus vaccine. Will it work and when will we know? Plus the dangers of complacency, how Japan went from success story to a critical condition. You're watching The Virus. Hello, I'm Jeremy Fernandez. Australia's race against COVID-19 continues to gain pace. The daily increase in cases is now consistently below 20 and only 8 positive tests were confirmed on Thursday nationwide. So the government's now firmly plotting the nation's path out of social isolation and the various other restrictions. The Prime Minister Scott Morrison has praised the public's response.
We are on the road back. And that is demonstrated by the measures that we've already taken. And we're on the way back to a COVID-safe economy as well, which is what we have to achieve.
Now, this graph shows the total number of confirmed cases adjusted for population size. It illustrates where in Australia the outbreaks are persisting. Most jurisdictions are on roughly the same trajectory, except Tasmania, which has the largest number of infections per 100,000 residents. This data leans heavily on testing, which removes the unknowns, and authorities need reliable figures before they can take further action.
National Cabinet's very clear that they want to be absolutely confident before relaxing any measures that we are in a position in this country to detect any community transmission of any significance.
One of the biggest developments of the week has been the human trial of a vaccine in the UK. The lead researchers are optimistic it will yield useful results, even though most vaccines normally take years to develop. Australia's played an important role too. Scientists from the CSIRO helped clear its use on human volunteers after conducting animal trials. More than 60 countries are spending billions of dollars searching for a vaccine. The UK is the only one to have advanced this far.
We could know whether the vaccine works in as little as a few months, but it could take 6 months or more. And it so much depends on what happens with transmission of the virus here in the UK.
I'm very optimistic it's going to work. Formally, we are testing it in an efficacy study. There's absolutely no suggestion we're going to start using this vaccine in a wider population before we've demonstrated that it actually works.
So, how does this vaccine work? The scientists from Oxford University have specifically looked at the genetic code of the spike protein that sits on the surface of the virus. Researchers have reproduced that protein and effectively put it inside a harmless virus. Once that's injected into the body, the harmless virus enters cells. The immune system responds by making antibodies and what are known as T cells. It's hoped they would be ready to target and destroy COVID-19 if it were to enter the body later. So in just weeks, Japan has gone from international success story to dealing with a second wave of infections that's crippling Tokyo's hospital system. It's a clear demonstration of why social controls are so important to fighting the virus and why the government here is wary of complacency. As coronavirus started to grip the world, one of the countries in focus early on was Japan. The Tokyo Olympics were getting closer, and no one could see how an event that brought together 10,000 athletes and up to 600,000 overseas visitors could possibly still go ahead. There was another problem, the Diamond Princess. The virus-riddled cruise ship docked in Yokohama was full of international passengers, and their plight caught the eye of the world's media. But despite the attention on Japan, the rate of infection among its citizens was remarkably low. That was attributed to its customs that put a high value on personal hygiene, including the use of face masks when a person has a cold or flu. Tradition also plays a part. Japanese culture limits person-to-person contact in public, and people strongly comply with those social mores. That led to officials focusing on containing infection clusters rather than widespread testing. The Prime Minister even declared there would be no European-style shutdown. This strategy meant that fewer than 100,000 people in a country of 126 million people were tested. Experts say it was that low testing rate and a false sense of security that changed everything.
Concrete message to stay home and don't go out, and keep the distance of 2 meters away if you had to go out. These messages are not very effectively delivered, and a lot of people believing in wearing a mask is a solution, which is not.
Now, a state of emergency has been extended to the whole country. Business has been suspended and residents have been asked to isolate at home. The goal is an ambitious 80% reduction in person-to-person contact and a 70% cut to the number of commuters. The health system is also squarely on the back foot. Medical equipment that's in high demand around the world is now also being urgently sought by Japanese hospitals that are forecasting acute shortages within a week. With more than 18 million people aged 75 or over, the spread of coronavirus in Japan could have a devastating impact. Experts say there could be 400,000 coronavirus-related deaths if the strict social isolation measures are not met. Now, every week we've been putting your questions to an expert panel. This week we're joined by our national medical reporter Sophie Scott and Dr Sanjaya Senanayake, an infectious diseases expert at the Australian National University. Dr Senanayake, a question received via the ABC News website. How accurate is the current testing?
That's a hard one to know, Jeremy, because there's no gold standard to really compare this to. So if we had a new test for picking up golden staph in blood, we've already got blood cultures. That's our gold standard we've been using for decades, and we could match this new test against that. But for COVID-19, we don't have a gold standard test. So the current test we are using, the PCR test, where we put a swab in the throat and in the back of the nose, they're our gold standard. But trying to work around that, we think that it's probably picking up about 70% of cases.
Sophie, we're getting this question over and over again across the weeks. Can you get COVID-19 a second, third or fourth time? What is the latest science telling us about that?
Well, look, this is interesting. There was some early suggestions early on that was a possibility, and then that was sort of ruled out. But in recent times, there's been some cases in South Korea where people had the condition, then they tested negative, and then they tested positive again. And so I think there was about 91 patients who they're not saying they're saying the disease was reactivated in those patients. Now, they're not exactly sure why that happened, but this is probably the biggest cohort where they've seen the reactivation of the disease.
What does the science tell us at the moment about whether men or women are worse affected by coronavirus when they do fall sick?
So it looks like, Jeremy, that men are more likely to die from COVID-19 than women. And there may be a couple of reasons for that. First of all, we know that people with chronic health conditions, such as chronic lung disease, chronic heart disease, diabetes, hypertension, seem to have an increased risk of a bad outcome with COVID-19. And these seem to be conditions that we'll see more often in men than in women. There's also an association with smoking with a lot of these chronic conditions. And certainly with China, we know that men significantly smoke more than women do. And also the other issue is one of immunity. Women seem to have a stronger immune system than men. Now, this could be an evolutionary mechanism to protect the unborn fetus, for the mother to have a strong immune system that they can pass to the fetus. And this protects women against really a number of infections compared to men. Now, the downside of that is you've probably heard of conditions called autoimmune diseases, where the body's own immune system is so hyped up it can cause damage to an individual. Now, that you would see in 80% of autoimmune diseases seem to occur in women, and that just sort of shows the strength of the immune system in women.
Well, there's more from that Q&A, including what the return to school means for the fight against COVID-19. You'll find it on the ABC News YouTube and Facebook channels. We'll be back next week. For now, goodbye.